just go quickly through the important steps to pay attention to during your application to the training system. And I also want to give you some tricks that help me to get into my training program of choice, which is cardiology. Uh, I just I'm going to share with you my slide set. In the end, we will have an open Q&A session. I want to hear from you the challenges you faced so far during your applications in the past, and if you need any special help during your application, I will be quite happy to help you with that. I'm going to share my slide set, and now I am about 3.5 years in the UK. I started my cardiology training this year, and I'm really happy to share with you my experience and to answer any of your questions regarding your training application. So far I am my training program is called the Academic Clinical Training Program. I'm doing that in Bristol University. My special interest is intervention cardiology. I did a master's in intervention cardiology, and I also worked in the University of Cambridge as a clinical supervisor, and I did postgraduate certification in medical education from Cambridge, and I have the European Board in Heart Failure as well. Uh, so, to, and I have to say that I did a lot of mistakes during my pathway, and today I would do my best to make you avoid repeating the same mistakes to make your pathway easier into your training system. Uh, so the first question you have to think about why you want to get into training in the UK. Because as you know, in the UK you can choose one of two pathways. You can stay outside the training, and outside the training you can still enjoy a lot of privileges, like better salary. You can be offered some advantages. It can be easier in some instances, but why is it why you we going into training is something important to think about in the UK. Can anyone share with me their thoughts? Why you think? Just unmute yourself and share with us why you think going into training might be something better to think about rather than staying outside the training system. Can anyone unmute themselves and share their thoughts with us?
Assalamu alaikum, Dr. Amr.
Alaikum salam.
I think going to the training is the ideal way if you're interested in subspecialty, and if you're aiming for a better training experience, and later on you will be a substantive consultant, so you can help others, you can supervise others, help them signing their competences. And also if you want to work abroad outside of the UK, so it's a well-respected training certificate which allow you to go again to the Gulf countries if you're interested in working there, or any other countries.
Yeah.
So I think, to be honest, I know it's not an easy way, but this is the ideal way if you want to achieve something in your life, I think.
May you tell us your name, please?
My name is Muhammad.
Muhammad. Thank you, Muhammad. What you said is absolutely right, Muhammad. Although, if you remained outside the training is not a big problem, you can still go do you can still have a very good career in the UK outside the training. But as within the training, there are few privileges which you can get being in the training system. First, the training system in the UK is well structured. So being a trainee, you will have the obligation on the consultant to teach you, to let you do the procedures you need to do. You have to fulfill your logbook, even if you are not a very active person. You will still have the obligation to finish your logbook and go through the training. You will always have supervision from your educational supervisor, from the RCB tutors. A lot of people are looking after your portfolio. So this is actually a very strong motive to let you finish your training, which is not the same if you choose to stay outside the training system. Second thing which Muhammad has mentioned is that the CCT certificate is it's a well renowned and it's a well respected training certificate all over the world, and you can use it not only in the UK. You can use it in if you want to go to Canada, Australia, if you want to go back to the Middle East. So it's a very well respected certificate. However, in the Caesar certificate is you still some countries can consider the Caesar certificate uh, as a evidence that you finished your training, but again, not all the countries look to it similar to the CCT. Third thing, in the UK there are very famous universities, well-known universities. I had the privilege to work in Cambridge. I'm now working in University of Bristol. So during your training, if you manage to score high during your interview, and you can choose a training program which allows you to work in one of the big universities or big university hospitals all over the world, and from there you can really make very good connections, very good relationships, and you will have a lot of opportunities as well to build up your CV as a consultant later on. The fourth thing is that your educational activities during the training system are funded by the deanery. You have a lot of opportunities, like funding opportunities during your training system to present your research. If you want to go to courses, if you want to do certificates, uh, and these opportunities are more allowed to trainees rather compared to non-trainees. Another point is you will have very good chance to be involved in research if that's something which you are interested in. However, the pay rate for trainees can be sometimes a little bit less than non-trainees, because in as a non-trainee you can join uh, any job at any pay scale according to how you discuss and negotiate with the HR. But in the training, it's like a very rigid framework, so you have to go through the ladder from the bottom upwards. So sometimes you may find your non-trainee colleagues are earning a bit more money than you. Uh, am I clear so far? Is there any questions about the advantages of going into training? Just feel free to unmute yourself because it's a bit difficult for me to look in on the chat. Yeah, I think people are saying it's clear. Okay, good. So I will move on to the next point. So, what are the challenges of going into training in the UK? The first thing is there are a really large number of IMGs who are starting to come to the UK. All of us are interested in joining training, and as we all see, people talking on the IMG groups how difficult it is to find the locum opportunities at the moment. So the number of IMGs are increasing. So second thing, Some people even they can find the GMC registration is a bit difficult. It can be challenging for some people. I think it's not the case with you, but still it's a bit of challenge. The third important thing to consider is that the longer the time you spend outside without the job you like, it's like you are losing money because once you get into training, if you are planning to work somewhere outside the UK for like a better opportunity, you can start getting and earning better salary, for example, outside the UK. So it's really important to try to get into training as soon as you can. And sometimes uh, people who come to the UK from overseas, they have really very good experience, but they don't have the chance. And this to chance the chance to show their skills, and this also one of the challenges we face when we start the training here. Uh, so I just want to start talking about going into the training job. I There are four cornerstones here when you think about training. If you want to get into training job, these are the four cornerstones. The first is your self-assessment score. The second is how to present yourself in the application in the when you apply to the training job on Oriel. The third thing is your performance in the interview, and the fourth thing is you have to know by heart your CV. You have to complete the missing things, and you have to know your final aim, what you are aiming for after in your career. What specialty you want to do? What do you want to stay in the UK or you want to travel abroad? These things are really important as they will help you to choose your training pathway. Okay, so just in short, the training in the UK, there are first there is the foundation training. The foundation training is a two-year program, F1 and F2, and there is another some sort of modified foundation training is called the standalone F2 year, the foundation year 2, which is like 1 year of foundation training. It's sometimes it's useful for IMGs who come to the UK immediately after their medical school. They did some internship back home, and they just want to gain some more experience in a training program under supervision. It's called the F2 standalone training. Uh, uh, then after that we come to the core training or GP training. So some doctors choose to go into GP training after doing the foundation training. GP training is a 3-year program. They are trying to give them a lot of advantages to encourage people to go into GP training. Uh, it's the shortest training pathway in the UK, and after you finish these 3 years, you will become a fully certified GP, which is similar to family medicine in America. You earn a CCT by the end of the 3 years, and you can work as a family medicine consultant outside the UK or in Canada or Australia. Uh, the advantage of GP training is short duration, but it's a very broad specialty. So you really need to love it in order to work well in GP, and they also have a lot of workload nowadays. Uh, you can go into core medical training, which is called the internal medicine training, or IMT. IMT is a 3 year program. The first 2 years you work as an SHO, and the third year you act as a registrar. During these 3 years, you have to finish your MRCP, and you start to build up your CV for higher specialty training. There is a core surgical training, which is still 2 year program compared to medical training, medical core training, which is 3 years. So core surgical training is 2 year program, and after that you apply to the higher specialty training in surgery. And there is an interesting pathway called the clinical academic training, similar to the one I am in at the moment. Uh, you can be an academic clinical trainee either as a foundational in the foundational academic training, or as a internal medicine training. And after you finish the academic clinical fellowship, you will join as a run through into the higher specialty training. So after you, if you do an academic clinical trainee training program in respiratory medicine, you will do the IMT 1, 2, and 3, and you go directly into respiratory ST4. You don't have to do another interview at the level of ST4. And but you have to have a lot of interest in research, and you may be looking for doing a higher degree like PhD, uh, uh, presenting in conferences, doing publications, and working in the university. This should be part of your interest. Uh, is everything clear so far, or is there any questions? Just don't hesitate to stop me if you have any questions. Please unmute yourself and ask your question. Can anyone just say it's okay, or shall I go forward?
Yes, it's okay.
Okay. Uh, okay. So next, I want to speak about how to score in the self-assessment. So when you start your application on Oriel, if you are planning to apply in October, this October, try to put your main aim as to score the highest in all the domains. Usually there are several domains on which they score you. This includes your first your postgraduate, if you did any postgraduate degrees or not, if if you have any prizes or distinct like achievements, academic achievements, any prizes, any if you scored high during your medical school, and then they score you for publication, for teaching, for leadership, for quality improvement, and try to look on the scoring tables and try to aim to achieve the highest score in all the domains. This should be your main aim. So, but the question comes: what if you didn't achieve anything in one of the domains? So in that case, you will not get the score for this domain, but it will be really useful to show to the assessor of your application that you have interest in that domain. For example, if you didn't have the chance to do any quality improvement project in your career, and you are going to lose all the marks on that domain, you can still do an online course in quality improvement. And this is something which it gives a very good impression for the assessor of your application for training. So you can do. I will. There are two online platforms which you can find the very useful courses on. One of them is called Learn PRN, and the second one is called Coursera. So I found like very good and very interesting courses on Coursera for patient safety, quality improvement. Learn PRN, you can find also very useful courses just to give the impression that you have interest in that domain, but you didn't have the chance to do an achievement. And the last thing, if you really struggle to just to build up your CV, if you need some more assistance, there are some people who provide scientific services for people applying to training. I will put in the chat the one. It's one of them is called the Medical Career Masters. They are like group of professionals. They will guide you on how to build your CV. If you want to write a publication, they will guide you how to do that. If you wanted to present in a conference, they will give you the guidance. I will put in the chat their email, in case someone wanted to get in contact with them. But if you manage to do your own stuff, that will be absolutely fine. Okay, then I will move on to the next point. So this is how you have to score the highest possible in your application. Next, you will have to to present yourself in the by written words in the application. And this is quite challenging actually, how to market yourself, how to sell yourself in the application. And the thing which I found very useful during my training application, first you have to read the answer. The answer to the questions in the application is usually found in the job description. So make sure, please, you read the job description very well. For example, they will ask for someone who has good communication skills. So in your application, you have to highlight that you are the person they are looking for and that you have good communication skills, and you can provide evidence on having good communication skills, like working in a team, doing clinical attachment, being supervised by a consultant, and having a recommendation letter. All these things count. They don't count in the score, but they make difference during the assessment of your application. The second thing, try to follow the CAMP framework when you answer the questions in your application. Try to follow the CAMP framework. So each question you have to mention something related to the clinical aspect, to the academic aspect, to management and the personnel, as much as you can. These 4 points will not fit in every answer, but try to involve them as much as you can in your answers to the questions in the application. So for example, if they ask you why you want to get into internal medicine training, why you want to do the IMT. So on the clinical aspect, for example, you can say, yeah, I want to experience the the, dealing with patients with multiple comorbidities. I wanted to work in a team with in a multidisciplinary team, people from different specialties. I have interest in managing medical certain medical problems like respiratory cases or cardiac cases. But is this not enough? You have to mention something related to the academic aspect of the job. So you have to mention something related to teaching. Academic means teaching, research, quality, or teaching and research, mainly teaching and research. So it's really important to mention that you have strong something related to teaching. You have interest in being involved to teaching to junior medical doctors, to foundation doctors, to medical students. You have interest in being involved in research. You have interest in writing case reports in medicine, something like that, something related to academia. Uh, Management means it's something related to patient safety and the quality improvement. So it's really important to mention that you have an interest in being involved in the quality improvement aspect of the job. For example, if you are dealing with applying to respiratory medicine, you can say something like, I'm interested in being involved in quality improvement projects in respiratory medicine. I want to run a quality improvement project on the use of inhalers, certain inhaler in asthmatic patients, something similar to that. On the personal level, not all the questions they have personal aspect, but you can involve something personal. Like I have a very long experience in that, or I have a good experience, good previous experience in that career, and I want to continue building up like my experience and my skills, or I want to subspecialize in something like intervention cardiology. If you are applying to cardiology, for example, so you can add something with the taste of personal aspect to your answer. Another important point is you have to give just a bear in mind that the person who is assessing your application is quite busy person. Usually the consultants are quite busy. They have very limited time to assess your application. They are looking into thousands of applications. So try to give in the first one or two sentences, try to give a focused summary of your achievements. And then you can mention some more details after the first two sentences. For example, if you are applying to a cardiology training and you are answering the question about what are your uh, achievements in publication or academic achievement. So the answer should be like this. You have to summarize your achievements in publication. So you will say something similar. I have published 4 articles in peer-reviewed journals, and I was first author in 2 of them. So you summarized your achievement, first two sentences, and then in the after the first two sentences, you started to give the details. You start to put the references of your publications. You start to put the details of the courses you attended, but you have to summarize the first one, two sentences what you achieved. I attended 3 courses in cardiology, including echocardiography, uh, intensive management of deteriorating heart failure patient, and the alert course. And then this is the summary, and then you started to give more details about your achievements after that. Just because the first two sentences are the one which will catch the attention of the assessor. They may lose the track of your words after that, because you will have like 100 words to write in the answer, but you have to be very focused in the first one or two sentences. Another important point is always try to describe the experiences you gained from your previous work. If you did any like clinical attachment, you don't have any NHS experience, you only did clinical attachment, and you should have something you gained from this clinical attachment. So what experience you gained from clinical attachment? You will find that you gained experience in team working, communication. You might have participated in some quality improvement work going on. You attended clinics, you attended to the cath lab, you attended procedures. So all these experiences, try to highlight them to just fit into the job description, and you, and tell the assessor that you are the person they are looking for as a trainee. This is a really important thing to consider. Is that clear so far? Do I need to repeat anything? Can anyone shout just to make sure people are still awake and everything is
Yes,
clear?
that's clear.
Clear? Okay. Okay, thanks, Sahar. Uh, so next, before going to performance in the interview, one of the important tips when you score yourself in the self-assessment, try to find something you have done, like a project you have done, like quality improvement and audit, and try to get the most of the points out of this project. So if, for example, you did an audit, either back in your home country or here in the UK, so having an audit, you can score for quality improvement. Second, you can write a scientific paper out of this audit, and you publish it, so you will get points for publication. Third, you can present your audit as a poster or as an oral presentation in a conference, and you will get points for as a presenter. So try to make most of the points of anything you have done. This is one of the arts you have to learn. And this is one of the things which is quite useful. If you didn't if you don't know how to do it, you can email me just or send me a message directly to the email I send it to you today. Just to reply to this email, and I can help you how to try to score the highest from anything you have done so far. So it's really important to try to get most of the points out of anything. Uh, and hopefully, if you did well, you wrote your application very well, and you you got the interview. This is the key step in the process, the whole process. Your performance in the interview is the key step here. And I really advise you keep working on your CV, even if you got the interview and you are waiting for the interview. Please keep building up your CV, just to have something to speak about during your interview. So, for example, if you got an interview for cardiology training, and by the time of your application you didn't have you didn't have an oral presentation in a conference. Try to get into a conference. Try to give an oral presentation. It will not change your scoring, but during the interviews they have their own scoring. They have a different scoring during the interview. So you still have to impress the interviewer and show them that you are the right person, the right trainee, and the future colleague as a consultant after the training. Uh, so keep working on your CV. Try to practice mock interviews, and this is one of the things I am planning to do after the application stage. I am planning to do some workshops on interviews. We can practice together mock interviews. Uh, it's really another important thing because we are most of us are IMGs. Sometimes we may find difficulty to express ourselves, especially under the stress of the interview. So it's really important to make a script for yourself. So just there are very common questions that are asked during the interviews, and you have to, based on your CV, you have to write your own script and try to rehearse this script. Keep studying this script and know it by heart. This will make your life much easier during the interview, especially under stress, because you may lose your words during the interview. You cannot express yourselves, even if you are the best candidate. But just because you cannot express yourself, that will be very challenging. Uh, uh, One of the other important aspects in the interview, you have to know which type of interview you are going to. So if you are going to academic interview, it's completely different from the clinical interview, and also uh, each one they have a different source of preparation. You have to study clinical because all the interviews they have clinical questions, so you have to study clinical questions. And I strongly recommend the Oxford Handbook of Acute Medicine. In the back, there are medical emergencies, and these medical emergencies they are more than enough for most interviews. Uh, so it's don't forget to study the clinical aspect as well. And as we said, in the academic interview, I will do another workshop in the future regarding the academic interview. The fourth pillar in the training to get the training job is you have to, as we said, you have to know your ultimate goal. You have to know your CV. It's a really shame that you don't know your CV. You don't know your achievements. So you have to go to the interview. You have to know what you have written in the application. You have to know your CV very well. And you have to know if you are what during your training. Do you want to finish your CCT only? Do you want to get time out of program and do some postgraduate certificates like a PhD? Do you want to be a clinician? Do you want to be a clinician and a researcher? All these things will help you to choose the right training pathway, and they will help you to know yourself most and to express yourself during the interview in a confident way. Uh, so these are my important take points on the application. And now I want to I want to hear from you your questions. What are the questions uh, running in your mind regarding the interview, and things which you found challenging in the past you want to ask about. Just please, if you feel free to just raise your hand or unmute yourself and ask your question. Yeah, okay. Hi, Bola. Yeah, okay, Bola. Okay. What you want to ask? Bola. Uh, so the surgery questions, do you want to ask about the questions in the applications or the questions for the interview? Yeah. So usually the interviews they will they will ask you uh, some like personal questions. The interview is not our main topic today, but usually in the interviews they will ask you some personal questions like why you want to get into surgery, uh, why you what have you achieved so far in surgery, uh, what is your plans, your career plans for surgery, and then they will ask you something related to professionalism, like what you will do if you found like a consultant coming for example drunk to work, what you will do if you found a colleague who called in sick and he's doing locum work elsewhere. And so the first part is the personal and the achievement. Second part is challenging situation. Third part is communication. So they will ask you, you have this patient, the patient received like we did amputation for because it's surgery. We did like excision for the wrong organ. How you will deal with that? Or the patient is deteriorating, family are quite upset, they think the patient has not received the proper care. How you gonna speak to the family? So the communication is one of the stations in the interview, uh, and uh, and then they will ask you something clinical, just basic clinical emergencies, like patient coming with uh, 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 like severe abdominal pain, is high temperature, low blood pressure. How you gonna deal with that? And they usually looking for how you are dealing with emergencies in ABCDE approach. This is usually the trick here. So don't no so I don't think Bola you will you have to find a good surgical book like I don't think the acute medicine book will help you in surgical interview, but the structure of the interview is almost the same. But you will have to ask one of the core surgical trainees what books they used to prepare for the core surgical training interview. But the structure is the same. Uh, if you are applying to higher specialty training in surgery, like ST3, there is usually another stage, an additional stage for like a registrar to test you how you would act as a surgical reg, like surgical emergencies. I hope I answered your question. Is there any other questions related to to the application or the like application to jobs in general? It's really important to make you yourself and your colleagues that clinical attachment is very useful. because I found a lot of people asking this question on the Facebook group. They ask if doing a clinical attachment is useful. It's really really useful because a lot of people they spend months waiting for a job. They apply, they do like more than 200 applications just to doing. If you manage to do a clinical attachment after your lab exam and use this clinical attachment to get some recommendation letters from consultant, get to know how the NHS work. This is quite useful. So tra- doing a clinical attachment is very useful in the CV and in the application. Is there any other topics you want me to do in the coming few weeks till your application? Something you want to cover just to help you uh, get through your application process? I- Is there anyone who has any suggestions?
Actually, I have a question.
Yeah, okay. Okay, Wajih.
Yeah, actually, I have been applying on track, so I'm wondering that is the right platform to apply. Because I think for your webinar, I read that it's written Oriel.
Okay, so Wajiha, can you tell me what training pathway you want to apply to?
Non-training.
Okay, so for non-training, track track.com is the right website. But if you want to apply to training, it's
Mm-hmm.
Oriel. It's a different website. It's called Oriel
Okay.
because the training system, the training pathway is like the jobs are advertised all over the country, nation based, nationwide basis. So it happens on Oriel, but for non-training jobs, it's track.com.
Okay, thank you so much. Because
Yeah,
I
no
have been
problem.
applying it, but maybe because of the long gap, or maybe because I have no UK experience, that might be the reason. It's been almost 10 months or so. Yeah.
So, what problems do you have, Wajiha, in your application so far? Yeah, just to share with us your problems, and I can help you with that.
Yeah, yeah. First of all, maybe the gap after my house job or the internship is the long. It's been like 6 years because I moved here to UK,
Hmm.
and then I started preparing initially for IELTS, then OET,
Okay.
and then a pleb, then pleb 2. So it
Hmm.
took me long year.
Okay.
Yeah, that's the thing. Firstly, and secondly, then only the that no clinical attachment or previous exposure here in hospital or any like a clinical attachment, anything like that. I haven't done
Yeah.
here. So
So I really strongly recommend, Wajiha, that you two things here to solve your problem and make you easier to get your first job. The
mm-hmm.
first thing, I strongly recommend that you do uh, a lot of courses, online courses
Okay,
related to patient safety and the quality improvement,
okay,
uh, and like some clinical skills. So if you go to as I said, learn. I will put it in the chat box. Learn BRN. This is quite useful. You can find a lot of courses, uh, and you can also do clinical attachment. This is quite useful. It's usually unpaid, but it's like 9 to 5 work. You can just go show people yourself. You now have the license to practice, so they can allow you to do some medical service to patients. You get some recommendation letters from consultants, and this is also considered an NHS experience. So when you put your application, for your job, you will mention that you have an NHS experience, and you spend your time gap. During this gap, you were doing courses, you will updating yourself, you have CBD points. So all these things, you have recommendation letters from consultants. All these things will strongly support your job application.
Okay, that is so kind of you. That is so useful. Thank you so much.
Yeah, thanks you. All the best. Is there any other questions from the attendees today, or
Yes.
any? Yeah. Okay,
Yeah.
Zara.
Yeah, actually, I have two questions. The
Okay.
first question is that I want to do a presentation in the hospital. So,
Hmm.
will it be counted on the application or not? The
Yeah.
second one is that if I haven't completed an audit or I maybe near the end
Hmm.
and it is the time of the closing of the application, so how to do the self-assessment score? Would would it be counted as a complete cycle or not?
Very good. Two questions here. So the local teaching is counted as a teaching experience if you are doing teaching uh, in your hospital. It counts as a teaching experience, but the score will not be very high. But you have to get the evidence. So the evidence can be a letter from the consultant who is supervising the teaching program, or it can be a form or feedback. Feedback is quite important. So make sure whenever you do any teaching activity, you collect feedback from the attendees. You have to print the papers and distribute the papers among the attendees and ask them to provide you with the feedback. Uh, and regarding your second question, regarding the audit, the most important thing is to get the letter from the audit team in your hospital. So if you are about to finish the audit cycle, but you still need like 2 more days and the application will close, make sure you have spoken to the audit team in your hospital and tell them you need the letter which confirms that you did the cycle in a BDSA cycle, and what was your role in the audit. Once you have this letter, it will not matter if you completed the audit in reality or not, but you have to get the letter from the audit team. Is that clear, Zara? Or
Yes, that's clear. Thank you.
okay, thank you. Okay, Aksa, go on. What you want to ask?
Yeah, hi.
Hi.
I wanted to ask about the non-training jobs, if
Okay.
that's okay.
Yeah. Go on. What you want to ask?
Okay. So I've been applying for jobs on track from last 6 months. Like everybody else, I'm also not able to secure a job. My question is that everyone tells us to write in the supporting info, describe everything, and use the relevant examples and all of these things. Can you please elaborate how to present? Because whenever I'm writing supporting info, it seems very long and very lengthy. And if I was like one of those people who were scrutinizing the application, I won't be able to read all of that.
Okay.
So
So
can you help me how
w-
to like write the effective and nice supporting info?
can you tell me what stage are you at the moment?
At the moment, I'm working as IMT3 in my home country.
Okay.
It's my third year in the training, and I don't have as such cap. I have almost 6 years of clinical experience, and I've passed my PLAB 2 exam.
Okay. And so do you have MRCP degree or not yet?
No, not yet.
Not yet.
MRCP is not required in my home country, but I am planning to give exam in January for
Okay.
IMT.
Okay. And can I ask uh, regarding your uh, what job are you applying to at the moment?
Basically, all the non-training jobs related to medicine and all the allied fields like cardiology, respiratory medicine, and geriatrics and stroke.
What level are you applying to? Is it
I've applied for
registrar SHO?
SHO level junior clinical. No, no, SHO level junior clinical fellow, trust grade fellow,
Okay, okay, sounds good.
FI2 level.
So the first thing you have to consider is, so do you live in the UK at the moment or you live outside?
No,
You,
I live in Pakistan. I'm from
you
Pakistan.
live in Pakistan. Okay, so the first thing you really, when you write your application, you have to highlight your strong points. As I said, you have
Right.
to focus very well on the first two sentences. Try to summarize your achievement in the first two sentences and try to score the highest in all the domains. It's really important to read the job description. When you apply to a job, the problem which most of us do is you have like a fixed template and you copy paste this template in all the applications, which is not useful. You have to adjust your application to the job description. So you have to read the job description and try to tell the assessor that you are the person they are looking for. Uh,
Okay.
so for example, if they are looking for a person with can I ask, have you done any clinical attachments in the UK or not?
No, I have not been able to secure any clinical attachment as well.
Okay. So one of the important things to focus on, I would say, is research. It's really important in your case to show them that you have strong commitment to research and quality improvement. Why I
I
chose
did
this?
one quality,
Hmm? Sorry,
I, sorry, I did one quality improvement project.
you have been on quality improvement project. Yeah, that's very good. So this is, as I said, it's a really very strong point because out of this quality improvement project, you can show them first your commitment to patient safety and the quality improvement. Second, you can write a scientific paper and get it published as a first author, which will give you a very good weight during the application. You can present your quality improvement project in a conference. If you do these
Right.
things, I'm
Mhm.
quite sure that you will secure the job in the first chance. Do you have any difficulty achieving these things on your own?
I have not worked on research, but in my applications, I do show interest that I'm working on different courses and attended various, short courses for research methodologies and all the meta-analysis papers. And I've been doing postgraduate certification in medical education
Very good.
to show
Okay.
my interest in these things, but
Okay.
nothing is helping me so far. It's very strange. Maybe the way I'm writing or presenting myself in the application is wrong because I've
So
been continuously working on my CV.
so try to read the job description before you send the application, before you submit the application. Read the job description and try to fulfill all the points when you write your application. This is my advice for you. So if they are
Oh,
looking for good communication skills, try to make sure you mentioned in the first sentence you have strong communication skills. Okay?
right. So you mean like the first paragraph gives the summary and then describe everything later
Yeah,
on.
exactly. Because the consultants are quite busy in the NHS, very, very busy, I would say. And they will only read the first one, two sentences. You have to mention to tell them in these one, two sentences, you are the person they are looking for. You have strong
Right.
communication skills, you have strong team working skills. After that, and just to give them very brief evidence. So I have strong communication skills working in big tertiary hospitals for 6 years. This is one sentence, and then you can
Right.
write more details after that. Okay? Or I have a
Right.
strong team working skills working in big tertiary hospitals and working in multidisciplinary teams. You will find all these
Right.
things written in the job description. So just copy paste what they are looking for into your application and then try to be very concise in the first one to two sentences. Then, if you want to add more details, this should be in the end.
Right. Okay, that's
Okay?
helpful.
Okay,
Do this
okay.
next time.
Yeah, all the best. Okay,
Thank
Omneya,
you.
do you want to unmute yourself? Would you like to unmute yourself and ask your question? Maimuna, is Maimuna here? Hello? Anyone else has any questions regarding application to either training or non-training jobs I can help with?
I want to ask, what is the least score for application stage that could be accepted to be shortlisted for an interview?
So it's really different from one year to another and from uh, from one specialty to another.
I'm talking
Uh,
about IMT.
for IMT, uh, again because what happens is they usually advertise certain number of jobs each year, and then based on the score of other people applying at the same time with you, they will decide what is the least score for the application. So that's why I said try to aim for the highest score possible, not only to get an interview, also because it will help you to get a higher score during the interview, and this can really make a big difference in your life. So if for example IMT is quite variable, there are IMT programs in very small hospitals, there are IMT programs in big tertiary centers like in London, in Oxford, in Cambridge. Second thing, if you live in a certain city and you don't want to leave it, if you secure a very good score in the application and in the interview, you will have the opportunity to stay in your city, and you can save thousands of pounds, literally thousands of pounds, moving from one city to another. So try to get the highest interview and the highest score you can, and don't think about the lowest score. Uh, and thanks Zara for sharing your email, because I can see that you got the chance to get a clinical attachment, and I hope you listen to how to make benefit of the clinical attachment to get letters and get the experience.
Thank you. Actually, I'm working in the UK right
Okay,
now. I've
okay,
started working in July.
okay.
But I've just seen an advertisement today about the attachment, so that's why I sent it.
Ah, okay, okay.
Okay.
And did you manage to sign your CRIST form?
Not yet. I have talked to my consultant and I have worked with him for just 2 months. He is
Hmm.
leaving right now, but he said that try to work on your Horus e-portfolio, fill
Okay.
things there, and then I will see those things, see your competencies, and then I will sign it.
Yeah,
But
very
I
good.
hope that he will not complicate things actually.
No, no, very good, very good. Yeah, all the best. This is the most important thing. If you sign the CRIST form, that's everything. Uh, you can apply once you get it signed. There
Yeah.
is a question. Yeah. Do you want to ask anything else?
I think we need to submit it at the time of application, right? So they don't give.
Yeah. You have to
Yeah.
submit it at the time of application.
Okay. Got it. Yeah. Thank you.
Okay. So there is a question from Maimuna. She's asking about the clinical gap as well. Uh, she has a 10-year gap, and she's asking if uh, if she how she can secure get shortlisted for a job. I think she has problem hearing us today. Uh, uh, can you try to log out and log in again? Is there any questions so far? Wajiha, do you want to ask another question, Wajiha?
Yes, I have two questions.
Okay.
Yeah, first is I'm not sure whether it is right to ask on this platform or not, but since I need to, I need actually the answer, because is it is it is it okay to like applying yourself, or you can go or ask the agency and seek help from them for the in order to secure a job in NHS? First question. Secondly, while like applying for job and not getting the job, how about if we can go for locum? Will that be the right thing to do when you have no previous exposure to NHS?
Yeah, good question. So what agency are you talking about? Are you talking about uh,
The private agency, like I used to see, I'm actually uh, like when you see nearby who like offer you locum jobs.
okay. Yeah, the hiring agents, the
Yes, yes,
recruitment
yes,
agents. Yeah, okay.
yes, yes.
So in the recruitment agents, y- you can you can do locum work. It's useful. Anything which will make you get the NHS experience is useful. And you can still apply through a recruitment agent if they will help you to get into the job. And once you are in the job, if you are not happy, you have the complete freedom to leave anytime. But once you get into the NHS system, that will
Mhm.
make your life much easier. So whatever can help you to get into the NHS system, go for it. If you want to go through locum work, if you want to go through recruitment agency, it will not affect your score by any chance.
Okay, and what you think, like, uh, b- uh, without any previous experience in NHS, do you think that locum would affect in any way? Because when you don't know the system, you don't know how things goes and how everything works. So will you think that people there would be there happy to guide us if we go for the locum?
Yeah, they do. As long as you are honest about your level of experience, they do. So I suggest if you want to start a locum job, try to start from like locum SHO or locum foundation doctor, even like locum F2, and
Mm-hmm.
uh, because the your work duties will be much different based on your experience, and
Okay.
also you have to speak to the recruitment agent and be open to them, tell them this is your first job and that you need some shadowing, unpaid shadowing, so they can arrange with the hiring, with the employing trust to have like 1 week, 2 week shadowing, but it will not be paid.
Yeah,
This is
that
a,
should be fine. Yeah.
yeah, as long as you are honest with people here, they are quite happy to help. But the problem is when you don't have the skills and you apply for something higher than your skill level. This is a big problem.
Mm-hmm. Yeah.
Okay, so it's not a shame if you are not. This is your first NHS job, and you were a consultant back home in your home country, and then you are quite new to the NHS. If you apply to consultant, you it will be a big problem for you because you won't function as properly as a consultant. So I would say even if you do shadowing, start from SHO shadowing, not like long-term contract, just 2 weeks, and then you can work as a registrar for a few months. After that, if you want to be a consultant, based on how people will see you in the trust, how they will appreciate your work.
Okay. Okay.
Okay.
Thank you so
Yeah.
much.
Yeah, no problem. Yeah. Are there any other questions from people in the chat? uh, Omnia, do you have any questions?
Yes, doctor. First, I'd like to thank you for sharing your valuable experience with us. My question is about the quality improvement projects and the publications. What if I have both but in a different specialty? That what I'm applying for. Would this point against the application or point towards the application?
Yeah, it's a really good question, Omnia. Thank you. Actually, the good thing about the scoring system, the scoring system does not look into the relation between your achievement and the specialty you are applying to.
Mm-hmm,
But if you are applying to specialty training, higher specialty training like ST4, ST3, ST4 level as in training,
mm-hmm,
it there is there are 10 points on your commitment to specialty.
mm-hmm,
So having some achievement in another specialty still will give you the score, but if you manage to do some achievements related to the specialty you are applying to, this will give you higher score. This only
mm-hmm.
applies to the higher specialty training. But in core medical training or core surgical training or GP training, any achievement related to academia will give you the score and help you with your application.
Mhm. Great. So
Okay.
my second question is regarding the evidence that you have talked about. So, do I need to collect evidence for all the teaching sessions that I have conducted, or just as an example, one or two is enough or enough?
So what you can do, it depends on how much you want to score yourself on the scoring system, because each type of teaching has a different score. So if you are doing like sporadic teaching sessions, uh, it you don't necessarily get all the evidence for all the teaching sessions you have done. One
Mm-hmm,
like two sessions with the feedback from your supervisor or feedback
mm-hmm,
from attendees will be enough. But if you participated in a teaching program, like
mm-hmm.
if you have been teaching to medical student over long period of time,
Yes.
this will make much difference. It will give you
Okay.
higher score.
I am an academic. So
Yeah, so
I teach postgrads
okay.
for a number of years, but it would be difficult for me to collect from all the rounds that I have conducted lectures to,
Yeah.
and also the feedback would be in a different language. So, do I need to translate all these for them?
No, what you can do in this case, it's better to get the feedback from the head of your
Okay,
department. Yeah,
okay,
this is the best thing. So you can summarize all your teaching experience in one letter
okay.
and include the feedback from the head of your department in the same
Mhm.
letter and let the head of your department sign the letter for you.
Okay, and they can contact the head of the department
Yeah,
because it may be multiple heads, the previous head and the new head, something like this, because this was a long years. You
no,
understand
there
me?
is. Yeah, I understand. Just to try to find the one head, like one consultant or one head of the department who is
Hmm.
happy to summarize all, who knows you for all these years. He
Okay.
knows what teaching activities have you been doing over these years, and
Hmm.
they are happy for you for you to summarize all the evidence in one letter, because
Hmm.
getting multiple letters doesn't make any benefit. It's better to
Yes.
do it from one person, and this person can be a point of contact if they want to confirm this evidence. They can be a point of contact after that.
Okay.
Okay.
Great. Yeah. Could you allow me for a more question?
Yeah, yeah, yeah.
Okay. So, if anything happened, if you are accepted and anything happened and you have to resign from the training,
Okay.
okay, does it affect if you would like to apply at the next level to the higher specialty training if your conditions have improved?
So it will not affect you, but there is a very important question which is usually put uh, in any training application,
Mm-hmm.
and the question is, have you if you have been dismissed from the training program, like you did something wrong and they moved you out of the
Yeah,
training program. This is usually the main problem.
yeah, but
But
in my case, yeah, I'm not asking about this. I'm asking about if any circumstances happened and you don't have the ability to complete your training, and you left the training after 1.5 year or 2 years, and you didn't complete the full 3 years,
yeah,
and then you have your conditions have improved, and you are now to apply for the higher specialty. So this would point against you.
no, no. So as long as you have like a justification why you left the training, that should be this will not cause any problem for you. The problem
Mhm.
is you don't try to show yourself as someone who is
Yes.
careless. This is a problem. Don't show yourself as someone who don't have commitment to finish what they have started. But if you have like a good justification why you resigned from the training,
Mm-hmm.
for example, for family causes, for you wanted to work in a different country, something like that, there should be a problem. The problem is when you, as I said, when you do something wrong and
And you are
they
dismissed.
dismiss you
Yes.
from the system. Yeah,
Okay. Okay. Thank you.
yeah, no problem. Is there any other questions for today, or any other suggestion for the coming session? Because I really want to help people to do all the training process quite smoothly. So if anyone would like to suggest any topics for the coming sessions, I'm more than happy to help.
Thank you very much. Actually, I'm looking forward for MOOCs interviews near the INT. That will help us
Yeah, I
maybe.
think that will it will be after the application. If once you finish your application stage, and we are closer to the interview period. I am planning to do some mock interviews.
Okay, thank you.
This
Yeah, no
would be
problem.
great. Thank you. Thank
Yeah,
you
no
for your
problem.
effort and thank you
Yeah,
for your time.
yeah, welcome anytime. Ataya, I can read your question. You asked about cardio and rheumatology ST1. So, I just want to mention there is no cardio and no rheumatology ST1. Ataya, still with us in the meeting? Can you
Yes, yes, I'm here.
hi,
I'm
hi.
here.
Is it Atya? Yes?
Yes, yes.
Yeah, there is no cardio ST1 or rheumatology ST1 is except in the academic clinical pathway. So in the academic clinical pathway, you know your specialty from the first stage. If you are ST1 cardiology, academic clinical cardiology, then you will stay in cardiology for the whole training. But for
Okay,
other all other specialties, you do the IMT, which is general medicine IMT training. It's a 3 year
okay.
program and it's general medicine. After that, you apply to specialty.
So for the clinical academic pathway,
Mm.
we do the cardiology training for how long? For if we are in cardio,
It
like we
will
don't have to do internal medicine at all.
No, you will do an internal medicine, but during your time in internal medicine, you will do research related to cardiology.
Okay.
So
O-
but and after your IMT, you know that you will go into cardiology training directly. You don't have to do another interview.
Okay, okay. Thank you.
Okay? Yeah, no problem. Okay, I think
I
that's
have a question.
yeah,
I'm
yeah,
sorry.
okay.
I'm sorry.
Yeah,
I
okay.
have a question. So, is changing specialities is doable? So, if I want to apply for academic clinical fellowship for a certain specialty,
Okay.
and for any reason, I need to change it to another one, academic clinical fellowship also,
Mm.
is it available or doable?
So, you can do it, but you have to first leave the program you are in. You have to resign from the program you are in, and you have to repeat the application from
From the start?
scratch. Yeah,
From the start?
yeah.
Wow.
Because the training. So you told me you have been academic in back home.
Yes,
So
I am.
so. Uh, have you done your PhD or not yet?
Yes, I have them.
You
And I
have
have my
PhD.
postdoc in the UK.
Very, very good. So you have few opportunities here. One of the opportunities you can apply to, uh, but you do you have the MRCP and all these things
In process.
in
In
process?
process. In process, yes. But
And
I haven't completed yet.
what level you want to apply to, Omnia?
ACF in one specialty of the internal medicine.
No, I mean, if you didn't get into ACF, what you want to do like as plan B?
Is ACF for only single specialty or more than one specialty?
No, you can up. It's one. It's single specialty. It's different from IMT. So
Mm.
in SEF, it's a run through program. You choose your specialty from the beginning and you go through the whole
Yeah, I
program.
understand this point. Yeah, thank you for clarifying this point because I don't have feedback from ACFs as you have mentioned right now. But I'm asking about is am I allowable to choose two different ACFs? Even in the training, you can apply for multiple trainings,
Yeah,
correct?
you
But is this the case for ACFs as well?
yeah
So
you can.
ACF cardiology, for example, and ACF rheumatology. So is this the way?
Yeah, you can. During your
Okay.
application, if you are still in the application process, you
Mm-hmm.
can apply to different ACFs. You can apply to, For example, I got ACF interview for cardiology,
Yes,
and I got for GP. You can be GP trainee and ACF GP trainee as well.
yes, yes.
Uh,
So
mm,
how many specialities you can choose?
whatever you
Endless,
want.
whatever. Okay, great.
Yeah, whatever you want. As long as you have you have evidence on your commitment to this specialty,
Mm-hmm,
you can apply.
mm-hmm.
The good thing about GP is it's multidisciplinary. It's
Yes,
a broad specialty. So whatever your specialty, you can do ACF GP training because any previous experience will fit into GP.
yes.
Because
But
in GP you can have something called the special interest. So you can be a
yes,
GP and you have a special interest in respiratory medicine, for example.
yes, yes. But
Mm,
if you have been accepted for two different ACFs, if you
okay.
have been accepted and you choose to go for one pathway of them, okay, and for any reason you changed your mind to the other one,
No, because
you are
once you
accepted.
accept one, the other will be rejected automatically.
Okay, I got you.
No, you cannot hold two
No,
in
no,
your
no.
hands.
I'm not asking. No, I'm not asking for holding both, but I'm asking that you are accepted from the start in both. So when you change, you will need to
No,
repeat the
the
experience
system
again.
the system will
Oh,
not allow you like that. You will get offer from two. You can get offer from two specialties,
yeah.
and once you choose one, the other will get rejected automatically.
Okay. No, you after you have gone through this specialty and you have started your training, if you at a certain point changed your mind, even if you have been accepted from the start from the
No,
panel,
no, no. You have to
okay,
start
you
the
have to start
application from.
again.
Yeah,
Yeah.
you have
You
to
will
start
just
again.
you will
Okay.
restart again, Omnia.
Yeah,
Okay.
yeah, yeah. You
Thank you.
have to.
I
But
got.
one of the good opportunities for you, Omnia, you can go if you can work as clinical fellow, non-training clinical fellow for like few months, and then you become registrar, for example, and you sign all your papers. You can get into your directly into your specialty training. You don't have to do all the core training
Yeah.
again, and then because you have the PhD, you can still apply to jobs in the university without being like a lecturer or assistant professor based on your experience, without being a formal academic trainee.
Mm-hmm. I got you.
Yeah, this is one of the things you can think about if you have because the aim of the ACF training actually is to prepare people to finish the PhD. But if you have already PhD and you have experience in the academic field,
Mm-hmm.
so I you can still combine your you can still go into clinical training and you do some research work on top, or and or you can apply directly to the university.
Yeah, but some requirements, like the full MRCP, I don't have at the moment. So I don't.
If you don't
Oh,
have the MRCB, it will be quite useful to apply for ACF, just to
yes,
invest your time in the ACF doing research and finish your MRCP,
exactly.
and after the ACF you apply to lecturer, clinical lecturer. This is like another training pathway.
Yeah.
If you look through the academic training after the ACF, after your PhD, you can apply to a clinical lecturership.
Okay, but is there any shortcut for the training for those who have some experience, or you have to complete the whole 3 years?
So you have to look on the CCT as it's a separate certificate. It's like a
Mm-hmm.
PhD. You have to finish 5 years of higher specialty training, and if you are starting at ACF, you can you can and you don't have the MRCP, you will
Mm-hmm.
have to start from uh, ST1 actually, because here they consider the ARC the MRCP
Yes,
is threshold for being registrar,
exactly. Yes.
and but what you can do if you have the MRCP, you can apply for IMT ACF from the level of ST3. So
Yes.
you don't have to start from ST1, you can apply to ST3 ACF because there is no ST4, ACF ST4.
Yeah. But the thing that being in a training would help me to complete the MRCP faster.
Yes.
This is the thing.
It's not always the case, to be honest. You can
Yes.
still you can if you work as a non-trainee clinical fellow in like ST1 ST2 level, or even in a good supporting hospital,
Mm-hmm.
they can and you have very good clinical experience. You just need, I would say, 1 to 2 months to know how the NHS work, and then you can apply to registrar in the same hospital. You can speak to them to upgrade yourself as a registrar, because by that time you know how the NHS work. You will be
Yes.
competent registrar, okay?
Yes.
Even before the MRCP. But you cannot do formal training, formal registrar training without MRCP. But you can
Yes.
do a registrar non-training registrar job without MRCP based on your previous experience.
Yes. I got you. Yes.
But it
It's
will make
a bit
a big
challenging.
difference in your salary. Just bear this in mind, uh, uh, because the salaries for for registrar is higher than SHO.
Yes, but the responsibility is higher as well.
Exactly. That's why I prefer if you just speak to start for, as I said, few months as SHO. I would say not more than 6 months, and then uh, try to find by that time you will get the experience and the competency to be a good registrar, and after 6 months either you can apply for non-training registrar in the same hospital or a different hospital,
Mm-hmm.
and while you are doing a non-training registrar you can still finish the MRCP,
Yeah, maybe a good option. Yes. Thank
and
you.
you will find as long as the people can see you are competent in your work, the consultants will be happy to sign your equivalency papers. So you will be equivalent to those who did the core training.
Yeah, but it depends on the consultant and the site
Yeah,
and
it
a
depends on
lot
the
of stuff.
consultant. But
Yes.
the good thing in the past, the final certificate was different. So the people who starts from ST1,
Hmm.
they get CCT. Those who start ST4, they get something called Caesar CP. This was in the past.
Yes.
Nowadays, a good thing, I don't know, but they changed the system, and everyone gets a CCT.
Mm-hmm.
In the
So
past, it was not this. It was not like this.
yes, it was a bit complicated in the past, I think.
Yeah,
Yeah,
yeah.
but can the consultant help me in the ACF for a shortcut?
No, no.
No.
Once you, the training system is quite rigid. It's
Mm-hmm.
they can help you outside the training framework. Once you are in the training framework, you have to go on the ladder step by
Yeah.
step.
So ACF starts from ST1.
It can start from ST1 or ST2 or ST3. So
Okay.
there are three entry points for ACF.
Okay. So without MRCP. Uh,
Without MRCP, you can start as ST1 or ST2.
okay. Okay,
but
thank you.
bear in mind
Yes,
you will not proceed from ST3 to ST4 without a MRCP.
yes, I know this point actually. Yes,
Mm.
yeah, and every ST take 1 year, correct?
Yeah, yeah, STU is 1 year.
Okay, okay, thank you.
Okay, yeah, no
Yeah,
problem.
thank you.
Is
Last
it?
question, sorry, related to this.
Yeah, okay.
For IMT, if I couldn't get shortlisted this time for ST1, can I apply next year for ST2 or not?
No, no.
No, it's just
This
ST1,
only
right?
ACF. No, this only for ACF.
Okay.
You can apply. There is ST2 ACF, ST1 ACF, or ST3. But for IMT, it's all or none. You can either apply for, you get uh, training seats this year, but you haven't been in the UK for long. So uh, if you manage to get into IMT this year, it'd be well and good. If not, as I said, you can work as a non-trainee for just 1 year, one as a registrar. You can you can speak to your trust, ask them to if they have any vacant registrar. But after you become a competent SHO, and you can work as a non-training registrar for the coming year, and by the next year, instead of applying to IMT again, you can apply directly to ST4. if you
Yes.
if you managed if you managed to get all the requirements fulfilled, and you get one of the consultant uh, signature that you are equivalent to the core medical trainee. But you will not be able to do that unless you work as a registrar. I know few of my friends who managed to do this. By the way, it's not something unrealistic. I have one of my friends. He arrived to the UK like 6 months earlier than me, but he went through this pathway. He did SHO for maybe 2 months, and the trust he was working in, they were looking for, but he had experience before, like before coming to the UK, he had maybe 7 years of experience, 6 or 7 years. So they allowed him to work as non-trainee registrar, and within this year, he managed to get all the forms signed. It's a very flexible. Outside the training is very flexible, to be honest. And he managed to, instead of doing 3 years of IMT, he managed to get into the training within 1.5 years, like higher specialty training. And in the end, nowadays, as I said, they changed the system, so the end certificate will be the same. It's it's no longer Caesar CP. It's now CCT. So I
Okay, thank you. Thank you for
yeah
this
just
detailed explanation. Yeah.
yeah once as long as the trust is good, they can help you to get the registrar job. And I think it's not that difficult. You If you speak to them early, speak to the HR people, speak to your educational supervisor, let them know that you have these years of experience, and you are working as an SHO. You feel that you are ready to be a registrar. They will help you. If you feel that the trusts are not supportive, then you can either choose to go into IMT or find another like registrar job in a different hospital.
And should be for 1 year, right? Registrar job.
At least 1 year. I don't think any consultant will sign you off before seeing you working as a registrar for at least 1 year in front of their eyes.
Yes, that's clear. Thank you very much.
Yeah, no problem. So Atya, uh, Atya, I don't understand your question. Sorry.
Yes, so I wanted to ask, like, when will be able to apply for internal medicine for next year? Like, I saw the Oriel website and there were clinical fellow posts right now, but there was no vacancy for the internal medicine training.
No, no, that the jobs will be advertised in late October. You will not find
Okay,
anything on Oriel. What is advertised on Oriel at the moment are the academic clinical fellow jobs, the ACF jobs.
okay, okay. Thank you.
So just yeah, just to keep for you will find the timeline for applications on the recruitment, the training recruitment. If you go to Health Education England recruitment website, you will find the timeline.
Okay, okay. Thank you.
Okay, thanks guys for coming today to the webinar. Just feel free to message me if you need any help with your application. I'm more than happy. I will put my email uh, in the chat box. I'm happy to help with any of you with application process. Any questions? I don't go frequently on Facebook, so I think sending me an email is a much better option. Uh, just I just writing my email. Sorry. It's not right. Yeah, yeah. Mishu Academy at now-academy.net. Any questions? Feel free to email me. Nice to have you all today. Have a good evening. Thank you all. Bye.
Thank you.
Bye.